A deadly Ebola outbreak in the Democratic Republic of Congo has claimed more than 500 lives, according to figures from the United Nations Health Agency. The health crisis comes as medical workers in Ituri province begin a two-day strike, citing poor working conditions and failure by the government to honor promised benefits.
The Democratic Republic of Congo has so far reported 1,624 cases and 521 deaths linked to the Ebola Bundibugyo virus. This outbreak, which has a case fatality rate of 32%, has no approved vaccine or treatments. The trial of two potential treatments against the Bundibugyo virus began in the DRC on the 2nd of July 2026, where more than 1,200 treatment doses were made available.
There is also efforts that are ongoing for a prophylaxis trial led by the National Institute for Biomedical Research and its partners.
As cases surge in the DRC, health workers in Ituri province have downed their tools, citing a lack of payment and adequate PPE for their work.
Yes, there is an issue with the payment, and some payment have arrived, but it is very complicated, and the government had limited opportunities to bring all the money at once in Ituri. So there are a group of people who have not been yet paid.
The workers have also complained of arrogance by providers deployed from Congo's capital, Kinshasa, and the excessive use of labor from other provinces without prioritizing local workers in Ituri.
So we will bring new health workers in so that they can be trained, for example, in case management. We will, for example, use the CME treatment centers here in Bunia.
As the Ebola outbreak intensifies in the DRC, WHO member states have reconvened to negotiate the remaining section of the landmark pandemic agreement struck last year, aimed at avoiding a repeat of the international panic seen during the COVID-19 pandemic. In the DRC, more than 10,000 contacts are being monitored with an overall follow-up rate of 82%. Treatment centers have been established, providing approximately 700 beds across 22 facilities, with efforts underway to add 300 more beds.
We continue to face major challenge. Existing treatment centers are operating at around 90% occupancy, placing significant pressure on the response.
To support the Ebola response in the DRC, the WHO requires $115 million, of which 32% has been received to date. Elizabeth Atieno, TV 47.